My name is Tara, and I am a registered dietitian here in Rochester. My topic this morning is wellness and nutrition in pregnancy. I have no disclosures. And my key points today will be about providing pretty general guidance around weight management and exercise during pregnancy, some key macro and micronutrient needs during pregnancy, and some common nutrition-related myths. I just wanted to put it out there to have some empathy for your pregnant patients. There's a big difference sometimes in these women's lives between their expectation and their reality. So although we may have all of the intention in the world to eat fish and go to the gym and kale and quinoa, sometimes it comes that looking at or smelling anything related to fish makes us nauseated. So sometimes we need to wait until that second trimester and just survive on a few saltines. We'll start with a polling question related to the risks of maternal obesity. This is a topic that we'll probably talk about for the next 2 days, just related to our general obesity epidemic, obviously affecting pregnant women as well. So which of the following are risks related to maternal obesity? Excellent. It is all of the above. So it's that list that was on the previous slide and more. So I think a lot of us are familiar with kind of general morbidity, mortality, hypertensive disorders, diabetes, but even having a mother who is pregnant and also has obesity lowers APGAR scores, increases instrumental and operative deliveries, can increase complications of anesthetics. So keeping in mind that it's not just about macrosomia, it's not just about weight retention. It also can worsen maternal obesity, worsen infant obesity, childhood obesity, and thinking way in the future, these children will eventually become childbearing mothers potentially, and now we've got a cyclical problem that hasn't been stopped. So if you have the chance, if you are working with childbearing age women in your practice who are struggling with obesity, not even yet pregnant, this would actually be an opportune time to help them manage their weight prior to pregnancy, knowing that obesity is one of the most common high-risk obese situations that ideally is preventable. But if you have a patient who is in your office and already pregnant, nothing to be done at that point in time, we can at least capitalize on this time as a teachable moment. Research shows us that pregnancy is actually an excellent behavior change time frame because of frequent follow-up and health care with physicians or NPs or midwives, higher risk perception of the mother growing a new child or fetus. The physical growth of the fetus actually can act as a stimulus for lifestyle change, including elimination of smoking, alcohol, better nutrition, and improved exercise. But as I mentioned previously, please be mindful of their lived experience in terms of fatigue, illness, or other comorbidities.